So let's talk about now your practice. So I know you use a lot of different techniques: craniosacral therapy, myofascial release, visceral manipulation, nerve mobilization. So how do you combine all of them on your practice?
Right. So that's a great question. So when someone comes in, they give me the history, and I make sure that I evaluate the whole body. And then I determine through a lot of different techniques and palpation and basically listening with my hands to determine something that's called the primary lesion. It's an osteopathic philosophy that is basically showing you the area of greatest tension in the body, the area of greatest restriction, the area that really needs treatment first. So what I do is I determine that area, kind of look through the body when somebody's laying on the table, and I work fully clothed, and I work through the body to try to do all my checks and balances to determine a region of the body that I think needs treatment. So let's say I determine it's in the right rib cage. Okay, so I put my hands on the right rib cage, and I start to determine, okay, what am I actually feeling for? So I'm trying to locate a very specific area of treatment. So, I'm first on, kind of palpating through the layers of tissue. Like, okay, maybe it's just, a tissue restriction in the fascia or connective tissue. So maybe I'm using myofascial release. Maybe I sink deeper, and all of a sudden the next thing I'm on the right rib cage, I'm like on a bone. Maybe I'll pull out more of an osseous technique and to start to work on the bony level of the rib. I dive deeper, and then the next thing I know, okay, maybe I dive even deeper to the liver, which is underneath the right rib cage. And so maybe then if I determine it's a liver issue, I'm using visceral manipulation. Maybe within that area, there's an intercostal nerve that's entrapped in one of the ribs. So I'm looking at the tissue and the intercostal muscles and the nerve that runs between all the ribs, and maybe there's a fixated nerve. So I'm using nerve mobilization. And so basically I'm using anatomy and I have an anatomy book in my head that using it in a three-dimensional way to try to visualize exactly what I'm working on, to pull out the toolbox to use exactly what I need. So if it's a nerve, I'm doing nerve mobilization. If it's spinal related and starts to go more into the spine, sometimes I'm just literally doing maybe a more joint or osseous technique on the vertebrae, or maybe I'm using craniosacral to influence the nervous system, so I'm basically using my palpation technique to determine the therapy I use at any given moment, and I weave in and out of the modalities pretty much moment by moment according to what I feel, because you could be treating a nerve and have that resolved, and the next thing you know, you're into the bone, and then you can resolve the rib cage restriction and then be into the tissue, and then it leads from the attachment of the rib to the thoracic transverse process, and then the next thing you know, you're doing like an osseous technique on the joint. So it really, that could all be within 1 minute of treatment. You're kind of weaving in and out of different modalities at any given point during a course of an hour treatment.
Yeah, I think that's so interesting that you have so many different options and tools, and you gotta have your very accurate palpation and rationale about everything, and then you go and use the technique that fits better. So I think this kind of investigative experience in physical therapy, I think attracts me so much, that you are challenged by, now is that, and then you follow that and you do another technique, and then you feel like a different thing, and then you go and use your other tool. So I think that's what makes our profession so interesting, that you have so many different options and so many different techniques and ways to help the patient. And that's what I love about all these, let's say, alternative techniques, that it's a little bit different from the traditional physical therapy and give you the ability to work in different ways.